How do we know if we have hidden depression? I've never heard of such a thing. People are walking around with a latent hidden depression, not even knowing it.
It's a good question. And so I was recently on another podcast where they were talking about depression versus symptoms of depression. And technically, there's only one clinical depression. In my lab, I have a research lab where when I'm diagnosing someone, I pull out the Bible of Psychiatry, the DSM-5, and I flip through it and I go through the symptoms of depression. Now, if you have symptoms of depression, but you don't meet criteria for losing functioning or having significant distress, technically, according to the Bible of Psychiatry, you don't have clinical depression. But that being said, after 2020, I was getting a lot of people in my lab coming in with symptoms of depression, but they were over-functioning. So they were the mom showing up, they were the entrepreneur showing up, they were the doctor showing up, the nurse showing up. So they had these symptoms of depression, but they were actually over-functioning. And because they were so deep in their work, they weren't really identifying with having distress because they weren't feeling. They were numbing. They had anhedonia. And I thought, well, if there are people like this, that I'm seeing in my practice, in my research lab, then how many out there are experiencing this? And because I'm a scientist, I did a little experiment and I put out a social media reel describing the symptoms of depression in a given day of someone who's over-functioning, very busy, showing up. And that reel got over 20 million views. So I thought, okay, I have to be onto something. So I decided to do the first clinical study in the world on high-functioning depression. And it was just published in a peer-reviewed journal article.
Oh my God, congrats.
Thank you.
So you really touched a nerve, I guess, with
Yes,
that
I did.
reel. There are people for whom life looks perfectly normal on the outside, but are, I guess, silently suffering.
They are. And, I was one of those people, to be honest. I was sitting at my desk in April 2020, giving a talk to these healthcare workers. And the questions coming through, they didn't know what was going to happen. They were asking questions like, should I even go home? What if I infect my family? How am I going to do this? People are dying. And I was on this Zoom call giving this talk, and I was feeling depressed. And I was like, wait a second, I'm depressed. I'm a board certified psychiatrist and researcher. And I was struck by my own depression that was hidden. And, I told you I kept seeing people in my lab, in my practice. I was experiencing it. So I just felt like it was something I needed to talk about. When I first started to talk about it with my colleagues, they were like, oh, high functioning depression isn't real. And I was like, this doesn't have to be a competition. There can be people who break down, who are classically crying, but there can also be people who are showing up. They're wearing this mask of productivity. They're pathologically productive. And in my research with PTSD, one of the symptoms of PTSD is avoidance, right? So you avoid things that bother you, that trigger you, like people, places, and situations. But busying yourself is also avoidance because you are not thinking about the thing that's painful. You're not processing your pain. And I think many of us, people who are listening right now, they busy themselves to avoid dealing with pain, to avoid dealing with trauma. I know I was one of them. And when I started doing the research, I was hearing more and more of this. So we have to think about depression differently. The DSM is great. It's a wonderful guideline, but the depression of your grandma isn't going to be the depression today. We have way different things we're dealing with. We have social media. We have constant access to bad news. We have this pandemic that we don't know how it's impacted us. The numbers show that maybe 75% of people were infected. We don't know what the long-term data is on that. So we have different factors to deal with. We have to think about depression differently because people express it differently. I know I did.
How much of this subclinical depression would you say is environmentally mediated? You're out from New York City, right?
Yes.
That's a pretty depressing place to live. Said with all love to New York, I'm born and raised in New York City, but the buildings crowd out the sun. You're not experiencing nature in any meaningful capacity. Most of the time. It's a stressful city. So how much of this is just we're living in the wrong environment?
That is a great question. And when I get these comments and DMs all the time, well, that's just capitalism, right? And I'm like, yeah, you're right. There's something called the biopsychosocial model. All medical students have this. And I wanted to make this available to everyone. I wanted to democratize mental health because in some parts of our wonderful country, there is only one psychiatrist for every 30,000 people. One, right? If I have 30 patients, I feel overwhelmed. So 30,000, right? So I wanted to make this information available to everyone because not everyone has access to a psychiatrist. The biopsychosocial model is basically the makeup of your happiness. The motto of my lab is understand the science of your happiness, because your happiness is different than mine. Your background is different than mine. Your biopsychosocial is different than mine. All human beings have a biopsychosocial, but the composites of that are going to be different. So biologically, I'll use myself as an example. I have low thyroid. So biologically, having this low thyroid, which is this organ that sits here on my neck that fuels the other organs, having that low thyroid puts me at risk for depression and anxiety and problems with sleep and metabolism issues. Psychologically, I have my own history of trauma. So I came to this country when I was small. We didn't have much. Sometimes we didn't have food. That scarcity trauma is a driving factor in how hard I work, right? And then other people have different factors in their trauma. So their attachment styles, I don't know your attachment style, but it's probably somewhat different from mine based on our We'll get into that at some point. But attachment style, resiliency factors, IQ, right? That's all psychological. And then social factors, right? You're living in LA, I'm living in New York, right? You identify that our environments are very different. Our behaviors every day may be different, like whether or not you move, the foods that you eat, if they're processed, whether or not you're in a toxic work environment, the quality of your relationships, the work that you do, those are all social factors, whether or not you drink a lot or smoke. So we all have different biopsychosocials. And I wanted this to be available to everyone because I didn't understand why we weren't sharing this with our patients. When doctors sit with you, you better believe they're writing up a biopsychosocial. But I think everyone needs access to this so they understand what makes them unique as a human. So you understand the science of your happiness, because many people are using tools that they see online or they read a book and they're like, why am I not happy? Well, it's because you're using these tools and you don't know how they apply to you. Understand the science of your happiness first and then use the tools. Some of the tools are not made for you. If you're using tools that help someone who, let's say they're neurodivergent and they have ADHD, well, if you have trauma, then you don't understand the science of your happiness. You need to understand what's supposed to work for you. But many of us are just using tools without understanding ourselves.
Yeah, you can't take a one-size-fits-all approach.
Yeah.
That makes perfect sense. So thyroid, there's so much to unpack there, but are there any biomarkers or blood tests? I guess thyroid function would be potentially one of them that might reveal hidden depression.
Well, there are risk factors for depression. Right now, we don't, unfortunately, have the science to say, come into my lab and let's take some blood and let's image your brain and you definitely have depression. Why? Again, the biopsychosocial model is so different. So one person with thyroid disease may not have symptoms of depression where another person will. And it's important to understand all of these biological factors. For example, I do research with postpartum depression. The depression symptoms in a postpartum mother are going to look very similar to the depression in another patient, let's say a man who has depression, right? Because symptoms of depression are like low energy, poor sleep, poor concentration, anhedonia, which is a lack of joy, a lack of pleasure. People say, meh, blah. But the driving factors behind, let's say, this postpartum mother's depression and this man's depression are going to be different. The postpartum mother is going to experience a drop in progesterone in her brain shortly after giving birth, or even in the third trimester of birth. Whereas the man, he doesn't have that. But there are other factors involved in that person's depression. That's why I want people to understand how unique they are. There's only going to be one you. There's only ever going to be one you, right? And there will only ever be one you. So why are you not understanding what makes you so unique and special? Understand your science, your biopsychosocial, your risk factors, and then do the work from there.
I love that so much. Yeah. Do you feel like in some ways we might though run the risk of pathologizing like a normal aspect of human emotion? Like this sort of subclinical, like I get depressed sometimes. Like, does that mean I need to book an appointment to see you or the equivalent of you here in Los Angeles?
There is so much power in naming things. As human beings, the uncertain freaks us out. We're scared when we don't know it, right? Think back to 2020, right? The uncertain is not good for humans. The naming of things and identifying things is important because it takes away the shame. It takes away the stigma. And I use a term in psychology called affect labeling. I don't know if you've heard of it, but it's when you are able to name an emotion, you're less afraid. So I liken it to if you were to, be in a room and the light turns off and then something falls. Some people will swing, right? Some people will panic. Others will try to escape. But if you turn that light on in that room and you see it's a book that fell, you're like, oh, it's just a book. I'm just gonna put it back on the bookshelf. You're not freaking out because you know what you're dealing with. The same happens when you are able to name an emotion, name a feeling. So when people like myself are pushing through life, overworking, they have symptoms of depression, and they're not able to identify what it is, they just feel confused. There's this uncertainty, like, what's wrong with me? Why am I like this? But then when you put a name to it and you say, actually, you're over-functioning to compensate for your depressive symptoms. That's high-functioning AF. That's what I call it. Then people are like, oh my gosh, sorry. That's my post-nasal drip. Then people are like, oh my gosh, like I know what I'm dealing with, right? I can name this. I'm over-functioning to compensate for my symptoms of depression. I have anhedonia, which is a lack of joy and pleasure in things. Blah, blah, empty. Then I can do something about it. So the naming is actually quite powerful in psychology. Not to pathologize, not to give people labels, but so that people know what they're dealing with, so then they can apply the correct tools. I told you that people don't understand the science of their happiness. When I talk about high-functioning depression, people are like, I finally have a name for what I'm dealing with, you know? It's so powerful. And there will be pundits, there will be people who criticize and say, oh, we're just naming normal things. Well, you know, you had to name clinical depression first, right? So there's this double standard, and it's not a competition. We're not saying that one is more important than the other, but I think there's a problem in mental health where we wait for people to break down, right? To check that box, no longer functioning, in crisis, in distress, and then we act. Well, the numbers are showing that the amount of mental health conditions, anxiety, depression, substance abuse, that's increasing. So if the people who are technically breaking down, losing functioning, if that number is going up, then there's a cue, because right before you break down, you have symptoms and then you break down. Why are we waiting? It is a broken model. And there's this renaissance in physical health where you see longevity scientists, you know, we're doing great work in menopause in longevity science to prevent breakdown, right? There's that renaissance and everyone's behind it. We need the same for mental health because there's less of us. There are less psychiatrists. There are less child psychologists. And we're seeing this boom in people breaking down because of mental health. Let's not wait till they break down. Let's give them the science. Let's give them the tools to understand how to maintain joy, how to prevent a clinical depression so that we're not dealing with the problems later on when we don't have enough providers.
It's so true. And I think you're so right in terms of thinking about the label or diagnosis less as a box and more as like a handle of sorts, so that you can better handle what it is that you're struggling with. I sometimes think that I'm a high functioning depressive. I mean, I've never been diagnosed with depression, but I've struggled with anhedonia personally. I've, struggled with nihilism, like feelings that, what does any of this matter? Life has no inherent meaning. Sometimes, occasionally it's been difficult to like get out of bed. You feel like you're just sort of running this perpetual hamster wheel to the grave. And then you look around, you see so much suffering in the world. And especially if you're an empathetic person and a compassionate person, it can wear on you. It could definitely take a toll. How does one know if they have high functioning depression? Is there like a checklist or, how do you, what's sort of like a self inventory that you might do?
When I first started talking about anhedonia, people had never heard of it. And for me, I'm in research, I've been using anhedonia rating scales for the past 10 years. So I thought it was like boring and not interesting, but people, they wanted more information on it. And the first time I talked about it on a major podcast, 10,000 people filled out my anhedonia rating scale like that day. So it overwhelmed my website wasn't made for that. I've upgraded since then, but there's a rating scale on my website where you can fill out anhedonia symptoms. So if you think about the word anhedonia, A is lack of, hed is hedonism, like pleasure, and the nia is like the condition, right, the symptom. So when you have joy, what is happiness to you, right? Many people don't know what it is. They think it's this idea of they achieve a career or they have a home or a partner, but that's not what happiness is in science. In my lab, when we look at happiness, you will rarely find the word happy on any of the rating scales. So there's a disconnect between what researchers think and what we study and what the general population thinks. Because when I have a patient come in, they're like, I just want to be happy. But in academia and in research, we're just trying to eradicate depression. But what happiness is just a plethora of these sensations that make being a human worth living. So when you eat, you savor and enjoy your food. When you're with a loved one, you feel connected. You don't feel lonely. When you're watching something beautiful, like a beautiful movie or scenery, you're in a state of awe. That's what joy is. But we have it wrong. We have this image of happiness being like the perfect family on Instagram, right? Or the being a boss lady, having all the things, right? But that is not what happiness is in terms of the human condition, in terms of the science of your happiness. It's a plethora of sensations. So when you fill out the Anhedonia rating scale and you look at things like, well, when you're sleeping and when you wake up, are you rested? No, right? When you have a cup of coffee, is it enjoyable to you? Oh, I just chug my coffee. When you're intimate with your loved one, are you just trying to get it over with, or are you in the moment? A lot of people are just trying to get through it, you know? Those are all the points of joy, right? That make up being, like, life is worth living, right? Like you were describing when you wake up, like, what's the point? If you're not having those points of joy, then you may have anhedonia. And anhedonia is a symptom of depression. But it's the silent symptom of depression that people overlooked, right? So when I think about depression, I think of twin sisters, right? There's depression and there's anhedonia. There's depressed mood and there's anhedonia. Depressed mood looks like a crying person who's not getting out of bed. Anhedonia is not crying. They're blunted. They're meh. So they're silent. So your doctor doesn't look for symptoms of anhedonia. They look for depression. They wait for you to break down, to no longer want to live, not, is your life worth living? Right? That's the nuance. And I wanted people to understand that, because then they'll realize, wait, there's nothing wrong with me. Other people feel this way. Anhedonia is a real thing, and it's robbing me of joy in life. And when you think about being a human, we're built with the DNA for dopamine for a reason. But many of us are on our phones. We're just like getting that dopamine hit. We're feeling blah, meh, because we're overwhelming our brain with things that are not enriching our lives. So put the phone down and start walking through grass, you know, start looking at a sunset. The parts of your brain that light up when you look at a sunset in real time are different than if you look at a sunset on your screen, right? So we need to actually become humans again, right? Instead of a human doing, you're a human being, and then tap into that. But yeah, that was a long-winded way of answering your question. You know, how do I know? Well, fill out the anhedonia scale. Where's your joy? You know? And again, the symptoms of depression are well known. Low energy, low concentration, low mood, feelings of hopelessness and guilt. If you have those symptoms, because I have a scale for that too, I'm a researcher, but you're still functioning. In fact, you're over-functioning. You have symptoms, and your doctor's going to wait for you to break down. I'm telling you, don't wait. Do something about it now. Prevent the breakdown, right? So you can still do the things that you want to love, that you do love in life, that you want to be doing.
I love that. How do you know if your own level of anhedonia is pathologic versus something that like characterizes who you are, like at your core? I mean, for as long as I can remember, as a child, I would get bored really easily. Like my parents would take me on vacation. I would just remember I would always be bored. I would constantly be just unimpressed. So there hasn't really been much of a change as far as my own personal level of anhedonia goes. But I guess for some, maybe, you know, if there's a change, is that something that might be more worrying?
If there's a change, and also, is it impacting your relationships? Usually I don't have someone coming to my office and saying, Doc, I'm anhedonic. It's, you know, I'm not doing as well at work, and my partner, you know, we're just not getting along. There's something happening. There's this shift that's occurring. Or, you know, they just feel as if life is not where they thought it was going to be. There's usually a turning point, because people are on this anhedonic road for quite some time until something changes, you know. And I always say that, you know, listen to your body, you know, like what's happening in your body. Sometimes I get people coming to my office who are referred from a medical doctor, like a physician for medical health. And they're experiencing some pain or some discomfort. Back pain is one thing that I see a lot of. and they're going through all these workups. They're in physical therapy, they're taking meds, and they're still having back pain. There's no root to it, or, it's not as bad as the imaging shows, but it's because they're just having so much angst, right? They're not sleeping properly, or when they're sleeping, they're turning their bodies, right? And we get down to the root of it, and it's really, a lot of it isn't what's happening in their head.
Interesting. So you see a lot of patients that have back pain with a psychosomatic origin?
I do.
Wow. I suffered with back pain for a really long time, and I just had back surgery a month ago. Actually, today, as we record this, it was a month ago, and I was sort of aware of some of that literature linking back pain to emotions and things like that. And for me, it was definitely not emotional. It was like completely structural. But that's very interesting that you like see this.
People, the mind-body connection is real. I used to be an anesthesiologist, so before I switched to psychiatry. But people carry a lot in their backs and their necks. So some of it is, again, look at the biopsychosocial. Some of it is what they do for a living. So people who tend to overwork, they're like this in front of their screens. And if you do that for long enough, you're going to get back pain,
Yeah.
And if you're not getting the right nutrition, because food and the nutrients in food replenish your body. And if you're not getting enough of a well-rounded diet, you're not getting good nutrients. So vitamin B deficiencies can lead to a lot of pain, a lot of odd neurological symptoms. And I've seen this so many times where people who aren't eating properly are coming in with all these pains, and they're like, you have to see a psychiatrist because there's something going on with you. Well, it's because they're not taking care of themselves, right? They're humans doing, not humans being. And so they're not eating foods that really enrich them, and they're experiencing neurological issues. And then people who are not getting good sleep, they have a lot of stress in their body, and they have unresolved trauma, and their body's just really like fighting it. They're in fight or flight. They're tense all the time, so they have a lot of pain. So absolutely, back pain is tied to a lot of mental health issues.
That's crazy. And I don't doubt it. Are there gender differences in terms of the prevalence of high-functioning depression?
Well, women are twice as likely to have depression and anxiety than men. Twice. I mean, whenever I hear that, and I've heard this many times, I'm just always in awe. Even though I know that women, have different hormones, they are more prone to these vulnerable pockets in life. Like, think about the teenage girl who's going through her first period and she's moody. Think about the postpartum mother who is told to be happy when 80% of women experience sadness when they give birth. 80%, right? And then think about perimenopause and menopause. Those are emotional roller coasters in terms of what the hormones do. So it's no wonder, right? And that's why I want people to understand the science of their happiness, because biologically, being a woman puts you at risk. Then you don't feel crazy. You don't feel that there's something wrong with you. You know that your hormones are tied to it. And it's not to say that women are crazy and they can't be trusted, but if we know what we're dealing with, then we're not going to overwhelm ourselves at certain parts in life. We're going to get more support, and others will support us. But if we don't know, then what do? We feel guilty because we're moody. We say, oh, I wish I was different, or I used to not be like this. We turn on ourselves. We blame ourselves. There's a lot of shame. But when we know, like, oh, and this is me, like before I get my period, I'm like, oh, like I know I'm not going to schedule myself too much right before my period, right? I'm going to take care of myself. I'm going to get better sleep. I'm going to eat better. I'm going to not, overwork myself at the gym. I'm going to probably do like more walking. Then my outcome is better. Then I don't blow up. Then I'm not moody, right? But that's where the knowledge comes in. Understanding the science of your happiness, and then shaping your life and your support around that science is so empowering.
As a psychiatrist, do you think we have does the field in your purview have an overprescription problem? I mean, there's being a lot of focus now being placed on, the prevalence of SSRI use in this country, and particularly for certain populations. I mean, what comes to mind for me is women over 40, 1 in 4 are on some kind of antidepressant drug. Do you believe we have an overprescription problem?
I don't. I think that there may be underdiagnosis. I think that people don't have access to care. So if there are, let's say, overprescribing, then it's probably like overprescribing without therapy, because a lot of the prescriptions are probably coming from people who are not therapists, because there just aren't enough of us. There aren't enough psychiatrists. And psychiatrists are trained to prescribe and to provide therapy. But there aren't enough of us. So people are getting their medications from primary care doctors, from OBs, and there's nothing wrong with that. But I do think that having that added support of therapy is beneficial. If antidepressants cured everything, we would all be on them. It'd be in the water. But they're not, right? And there's great supports. Remember I mentioned that women are twice as likely to have depression and anxiety. We need supports. I don't think there are enough interventions in terms of therapy, in terms of processing trauma, because women are also at high risk for trauma. When people think trauma, they think combat veterans. No, women are unfortunately survivors of sexual assault, right? A physical battery. And so I don't think there are enough supports in addition to the medication therapies.
Yeah. But there have been studies that have found that, for example, certain SSRI drugs in certain depressed populations, like people with mild depression, don't seem to derive an effect from these drugs more significant than they would exercise, for example, right? Like, at least from my vantage point, it does seem that there are people that are being prescribed these drugs that are not necessarily deriving benefit from them, but are likely deriving, the side effects and whatever from these drugs, like the impaired libido, weight gain, all that stuff.
Well, what I will tell you is that not everyone is ready to change their lives. Not everyone wants to do the work. Think about the practical aspects of therapy. You have to find a therapist, right? Then you have to find a therapist that you can afford. Then you have to find a therapist who fits into your schedule. Then you have to actually do the work, right? So for many people, that is not an option. And I think that's probably one of the factors getting in the way of maybe getting the most out of a medication management. I do both. I do medication prescriptions, and I also do therapy. But not everyone has access to someone like me. And that's why I want people to be very careful when they make statements like this, because as someone who sees patients every day in my practice, I've seen how having the support of an antidepressant, it may not eradicate your depression, but it'll get you better sleep. It'll mitigate anxiety. It may take you from like feeling depressed and wanting to end your life to actually being depressed but not wanting to end your life, And so I want people to be very careful about that, because antidepressant use is very, very rampant in this country. And there are many causes towards depression, right? We talk about the biopsychosocial. For many people, they can't even afford to get by, right? And their circumstances are depressing for them. What are we going to do? Take away the support of an antidepressant? They're going to need that to get to work, to take care of their kids. So I want us to be gentle when we approach people who are taking antidepressants, because you would never say to someone who's using an inhaler for their asthma, well, don't you think you need to just move to a place where you can breathe clearer? That would just sound so out of touch. Yes. Or someone who is on diabetes medicines, well, you should just eat less donuts. Well, not everyone has that self-control, right? Some of us have different factors driving the way that we eat. Some of us can't access healthy foods. We would never shame someone. But there's that shame with depression when we don't even realize the brain is a part of our bodies. Why are we telling people you're using too many antidepressants? That's a part of your body. And some people are more prone to depression than others. So I want us to be very careful when we talk about mental health conditions, because the brain is a part of our bodies and people do need support. And when we have these blanket statements, then, some people are very impressionable, and they'll say things like, well, maybe I should stop it. Maybe I need to do this differently. Two things can be true, right? Yes, antidepressant use is common, and we should also be implementing behavioral methods, therapies, other supports, right? They're not different truths, right?
Yeah.
They're the same.
No, I totally appreciate that. It doesn't help anybody to take a black or white stance, on something so complicated and nuanced, and particularly, when addressing such a diverse population as the United States population, where access is so different. I couldn't agree more. It's super important. We don't place a stigma on drugs or anything like that, but I think it relates to the the conversation now that many people are having regarding these GLP-1 agonist drugs, like these weight loss drugs. I'm super glad that we now have them on the market as a fail-safe for people for whom lifestyle change is difficult, if not impossible, and who've just experienced lifetimes of yo-yo dieting and maybe they live in food deserts where they don't have access to healthy food or what have you. I mean, there are many reasons that might push one towards, the use of one of these drugs. But I always think that it's best used as a fail-safe, like as a last line defense. The first line should always be, safe and healthy and effective lifestyle modifications, and if those don't work, then like I have a family member taking one of the GLP-1 drugs, and he's lost a lot of weight with it, thus lowering his risk for cardiovascular disease, Alzheimer's disease, and all of the other conditions that it's now being linked to. But then you hear some that suggest almost as though we should be putting semaglutide in the water supply. And
I haven't heard that, but I have, I've done several studies in my lab based on binge eating. And I can tell you that for some people, their metabolic picture is so challenging that I think they need that. They need that support. And with these people, like with these studies that I've done, there's usually a food journal, and there's also the medication intervention, right? So one is a therapy and one is a medication intervention. I could tell you with many people, they struggle. They can be the most disciplined, the most intelligent, have a great family support, but they're metabolically challenged. So they're going to need that support. Should it be in the water? No. Nothing should be in the water but water. Some would argue lithium, but no. But, I think we have to be careful with this messaging because there's a huge assumption, right? Because you see all these influencers and they're ripped and they're in their mansions and they're like, it's just like a matter of not having discipline. Easy for you to say, but like use empathy. And also like, I've worked with so many patients. Like I see children, adolescents, adults, and geriatric patients. Like being compassionate and empathic is so important, and understand that not everyone has your access and not everyone has your history, right? The science of your happiness. So try and like take it with a grain of salt and don't assume people have things that you have, because everyone has different struggles. And that metabolic challenge, that's something, it's really difficult. They get judged. People are viewed as being lazy, and it's really, really challenging for them to walk through life being judged for something that they can't control.
Yeah, certainly nobody should be judged. Mm-hmm. And you definitely should not be comparing yourself to influencers on social media who are all using filters, performance-enhancing drugs, have obsessive, probably likely even unhealthy relationships with food and or their bodies. And yeah, that's important. That's an important disclosure that's not often made.
It's not. And like, I see a lot of my adolescent male patients will come in and they're like, I want to look just like this guy. And they just have this image that it's so easy to be perfect. And there are so many patients that struggle with that physical embarrassment and that shame. Like, why can't I just be like this other person? And these are real challenges for them. And some people are abusing it, right? There's always like, there are people who are just using it when they shouldn't be. But I believe that the majority of people who are on these medications, they really have a hard time controlling their metabolic issues, and they're getting the appropriate care.
So what do we do then? I mean, so many people today are struggling with issues related to mental health. We live in stressful times. Social media is pervasive, and it is a double-edged sword in the sense that, most of us do need it to stay connected these days to our friends and loved ones. And many of us have businesses that require the use of social media, myself included. But on the other hand, it's not doing our mental health any favors. And then you zoom out and you look at the larger socio-cultural political environment where everybody's at each other's throats 24/7. And it seems almost as if we are living in a perfect storm for mental distress.
We are in the perfect storm. Absolutely. And like anything, we need to think about how it's impacting our lives. Social media impacts us. I truly believe that there's going to be a section in the Bible of Psychiatry one day talking specifically about how the use of social media and technology impacts us. And I know that people are studying this even today as we speak. There's a whole Stanford Zoom study center, right, where they're looking at the impacts of Zoom meetings on people's well-being. Why? Because it's unnatural to be looking at yourself when you're talking to others, right? That puts this level of self-scrutiny on us and that performance and that anxiety that we never had before. And being sedentary, sitting at a desk for that many meetings, that's not how human beings were designed. We were designed to move. Being on platforms where we see 10 faces at once, like, come on, there's nothing human about that. So yes, technology impacts us. And I do believe that we will have more data. There's already emerging data about children and how it impacts their self-esteem, their acceptance, the rejection that they feel. And we're looking at humans. There was a recent study looking at adult humans who were being deprived of phones that were seamlessly connected to the internet. That's different than like the phones growing up, like those flip phones. So basically smartphones, and they removed these adults from the smartphone access for 2 weeks. And they experienced something of an antidepressant effect. Now, not clinical depression, but like the symptoms of depression, like poor concentration, low mood, poor sleep, anhedonia, improved when they were removed from having access to these smartphones.
I don't
for
doubt
just
that.
2 weeks.
Damn.
Right? So we do need to think about how that plays into anhedonia, this numbing. And when you look at a phone, it's so immersive. There's easy access. The drugs that are most addictive are immersive with easy access. So they just feel as if they fit neatly into your life. But then we can become dependent on those drugs, right? The phone. We get dependent. So when we're not with it, we feel anxious. That's a form of withdrawal. Not the same clearly as a substance, but very similar in terms of the pathways of reward in our brain. And so what we have to realize whether or not we get anxious when our phones are not near us. That's a good indicator that maybe we're spending too much time on our phones. Something called FOMO, right?
Oh, yeah.
And so this study pulled adults away from this immersive technology, and they actually felt better. So you can do an experiment with yourself. You can say, okay, I'm going to limit my smartphone use to X amount of hours a day, or during these pockets of time a day, or when I'm with my family, I'm not going to have it in the room. When I'm sleeping, I'm not going to have it in the bedroom. And you can see whether or not your anhedonia improves, right? Does your sleep get better? Are you paying attention to your loved ones more? Are you more present? Is your focusing better? These are all symptoms of depression. So the study looked at people's, these symptoms of depression that improve. So it was almost like an antidepressant effect.
Wow. I feel better when my phone is not on me. Sometimes I'll go to the gym and I'll lock my phone in the locker just so I get, an hour of uninterrupted me time. I think that's great advice. If you can name one, a simple habit shift that somebody could make today to start feeling more joy, even if they don't feel like it's possible?
I think to feel more joy, first, and I'm going to say it again, understand the science of your happiness, right? So if you're someone who has unprocessed trauma, it's hard to be happy when you're in fight or flight. So if you're someone with unprocessed trauma and you're in fight or flight, do something that's grounding so you're present. And that could be as simple as drinking tea and letting all your emotions be there when you drink that tea. So that's like feeling the warmth in your hands. That's looking at the color of the tea, smelling it, listening to how it sounds as you feel it going down your throat, right? So that very present act can ground you. If you're someone who's neurodivergent, right, and it's hard to focus and be present, and that's what's blocking your happiness, then simplify your life, declutter, make it easier in the morning to get up, get your bag and out. So you're not flustering looking for your keys and trying to figure out your schedule. Simplify your life. If you're someone who has anhedonia and it's hard to enjoy things, maybe focus on one thing that day. I'm going to eat my meal without looking at a screen, and I'm going to describe all the flavors of my salad. I'm going to crunch the almonds. I'm going to taste the zest in the Caesar dressing. Those small interventions are increasing your points of joy. I mentioned that in my lab, we measure happiness based on points. It's not about becoming happy, the state that is static, that many of us strive for and we fail. It's about becoming happier. That nuance is so important because when you think about becoming happier, It's okay, how many points of joy can I get today? So that 1 point could be better sleep. That number 2 point could be more connection. It's about increasing the points every day to becoming happier. And then you're like, okay, well, today I'm 2 points happier than I was yesterday. And then you feel as if, okay, there's hope. But when you're like working towards this idea of happy, right? I will be happy when I have a partner, a career, a home, the perfect dog, then you may never be happy. And the research shows that people who delay happiness until they get a goal, they're still not happy. They're still searching. So try to increase your points every day. Tomorrow is not promised. We have today. So increase the points today.
It's also, happiness is an inside job. It's not something that you can just acquire with a new car or a better house, or, it's something that, you have to cultivate, and it's like a practice. Is it worth making the distinction between items, things, activities that bring you pleasure versus enduring happiness? Is there a difference between pleasure and happiness?
There is. So, sorry. Pleasure are these sensations, the dopamine bumps that you get from engaging in these human activities. Happiness tends to be this idea, right? That like, this is a state. This is what happiness looks like versus experiences versus idea. Different shift. But it can be a game changer for people who have been struggling with depression, with becoming happy all their lives, right? And I have patients who come in every day and they're like, when I thought about it differently, when I thought about getting these points by engaging in these human experiences that bring me pleasure and joy, that feels so much more doable. That feels so much more attainable. But when I was chasing happy, this idea, this ideal, I was coming up short. I felt like it was hopeless. And that very simple shift is so important because a lot of us are in our heads. I was the existential kid. I was the broody teenager who wore like the Wednesday outfits, right? Total like emu. And I used to think about like, what's the point of life? Blah, blah, blah. And then when I shifted that, as a researcher, like, how do I get points every day? It was eye-opening for me. And I started sitting with my daughter more and like, playing with her and being present versus like, I just want to be a good mom, then I'll be happy, right? Totally different shift.
I've heard it described or said that pleasure is dopamine mediated, whereas happiness is serotonin mediated. Is there any truth to that?
That's really scientific. There is some truth to that because it's very similar to what I was saying, right? Like the dopamine is the engaging in the activities that give you those hits, whereas serotonin,
we like get nerdy.
It's like the antidepressant that floods your brain, right, to give you that state. But I don't think you can really prove that, right? We're not there yet. The science isn't there yet.
Well, MDMA floods your brain with serotonin, right? And everybody who's taken MDMA knows it makes you feel pretty happy.
But serotonin interacts with dopamine and norepinephrine and other neurotransmitters, GABA. So it's not clean and cut. And that's why anyone who tells you like, I can image your brain and tell you what's going on, correlation is not the same as causation. It's, like that's great that we're getting there. We're not there yet, or else everybody would be getting their brain scanned and getting diagnosed, and then we wouldn't need psychiatrists. But again, the science of our happiness is so different. When your brain goes through the postpartum phase and your progesterone drops, that's not the same as serotonin, but there's interactions with GABA, right? That's why a lot of postpartum mothers are anxious and they have OCD-like symptoms where they're constantly checking to see if their baby's okay, because that progesterone interacts with the GABA. And so there's this link between anxiety and depression in the postpartum brain. So we're just such incredible humans.
It's so complicated.
So complex.
Yeah. I guess that is a very overly simplistic way of thinking about it. Because also there was that long-standing myth about depression being a chemical imbalance. That was sort of overturned fairly recently, wasn't it?
Yes. It's not that simple. And we have to think about the factors that play into the happiness, the science of your happiness, right? If we're that simple, again, everybody would be on a pill. We'd all be like serotonin happy, right? But it's not that simple. There are factors involved. Someone who's highly traumatized, who is having flashbacks every day, they're not going to be happy. Giving them like a dopamine hit isn't going to change their trauma. And that's why it's so important for us to understand our own happiness, the science of our own happiness.
Have you done any research with regards to psychedelic-assisted psychotherapy? I mean, we recently had Dr. Robin Carhart Harris on the show, who's one of the preeminent researchers in the space, using like psilocybin and treatment-resistant depression, stuff like that. Has that sort of crossed your purview at all? Well,
I am doing a study right now with a postpartum woman with a psilocybin-like medication. There's a tweak on it, and it is interesting. I can't talk about the results, but I think that, working with these agents is so important. There's a lot of restrictions. Certain states, I believe only Oregon allows you to use psilocybin without like getting arrested. But if you're not in a research facility like my lab, you don't have access to it. But I do think that is a part of the future that gives me hope in terms of treatment-resistant depression. Things like PTSD, where people have tried everything and they're still feeling stuck. But I do think that is a part of the future. And I'm very fortunate to be a part of it.
Yeah, no, I'm so grateful that you're on the front lines, like working on this stuff. Because I mean, what's so exciting to me about that research is that it's a natural substance where one or just a handful of doses in the right set and setting leads to enduring like symptom improvement to the point of remission for patients with treatment-resistant depression that would otherwise need to be on these drugs for life. And these drugs are not without their, like, there's no free lunch when it comes to synthetic pharmaceuticals. Like, they're not without their unintended effects. But these psychedelic drugs don't seem to have any enduring negative like effects, and the risk in the appropriate set and setting, the risk of adverse effects seems to be really low.
The issue is that there aren't enough people to assist the therapies. Like with these interventions, you have to have someone with the person to guide them through it. There just aren't enough of these people out there, and so that's the limitation. But I do hope that more professionals will get trained, that they're not going to be afraid of, using these interventions, and that they realize it's worth it to at least have this added skill set so that when the time comes, and hopefully if it is available, they can assist their patients through the guided therapy.
Yeah. So if someone is feeling off but can't pinpoint why, what's the first step you'd tell them to take today?
You are not alone. Validate. I say that happiness is within reach. And if you look at your hand, most of us have 5 fingers. And I have this system called the 5 V's. So the first step is validate how you feel. Accept it and acknowledge it. Many of us, you ask, how are you doing? And we'll say, I'm fine. You? If you're not fine, say it. Or like at least accept it in your mind. Self-validation is important. Number 2, express it. If you don't have someone to talk to, not everyone has access to a therapist or a loved one, many are lonely, write it down or sing it out if you're a singer or performer. Express it. That's called venting. And number 3 is values. Tap into what brings your life meaning and purpose. It doesn't have to be great. You don't have to go out and like change the whole world, but if you value nature, take a walk in nature as much as you can every day, or buy a plant. Do something that taps into your values. Number 4 is vitals. You only get one body. I tell my daughter every day, how many bodies did God give you? And she goes, 1. What do you got to do? Take care of it. Take care of your body. That could be a small intervention as drinking water or resting or taking a break to breathe. Honor your body. You only get one. And then the 5th is vision. We often get stuck in the past. Start planning joy. It doesn't have to be grand. It could be you got your kid to school on time. Sit down and enjoy a cup of coffee and say, wow, I did that. Like plan joy. Put it in your schedule. What am I going to plan for myself? If you're someone who takes care of everyone else, plan something for yourself, even if it's small. But that vision, that moving forward will keep you from getting stuck in the past. So I call it the 5 V's, and I use my hand. And usually when I give this talk in front of people, I hold my hand up, and it reminds me because my dad is a pastor. So I have this like very like evangelical way of expressing when I feel passionate about something. But look at your hand. Joy is within reach. You just forgot how to access it. But if you can tap into one of these 5 V's every day, you will be happier.
So valuable. There was something I saw online recently. It was really pithy, but I thought there was a profound truth to it. I'm curious what your take on it might be. It was essentially that if you go on vacation and your depression lifts, you weren't depressed. You were just living a shitty life. Something to that effect. I mean, maybe the way that I said it was a little bit more crude than the way that it was presented, or at least the way that I saw it. But yeah, like if you go on vacation and you're, suddenly not depressed anymore, well then maybe you weren't depressed to begin with. You were just living in an environment that wasn't appropriate for you.
I saw that trend. It was like it was repeated several times.
Yeah.
And I make that distinction, in one of my newsletters I wrote, are you depressed or is it burnout, right? So burnout was only recently included in the ICD code, which is the International Code for Medicine, only very recently. Does that mean that burnout didn't exist before then?
Is that the medical name?
Burnout
Wow.
is an actual term that was added to the ICD, which is like we have the DSM-5 here, but the ICD is the world's classification. But it was only recently added. And by definition, burnout is related to your occupational exposure. So if you're at work and you're like not inspired, you can't focus, you just can't wait to get out of there, you're irritable and moody, and then you are removed from that work setting, your burnout should lift if it's true burnout. And that's the difference between burnout and depression. Depression doesn't matter where you are. You still feel those symptoms. You still feel anhedonia, even if you're in a beautiful Bali beach, you still feel poor concentration. You still feel low energy. You still feel moody and sad at times or irritable. That doesn't lift, right? And that's a difference between a burnout, which is occupational hazard, and depression, which is, what's happening within you, right? So, or to you. So I think that it's important to listen to how you feel, listen to your body. If you go on vacation and you're like happy and refreshed and you're like excited, and then you come back to this situation, then that situation may not be for you. I'm not saying quit your job, but, start saving, know.
Yeah. Well, there's truth to it. So it's like you're probably burnt out.
Yes. But burnout can develop into a clinical depression, right? So like, again, the biopsychosocial is important because social stressors can impact everything else. When you look at the biopsychosocial Venn diagram, you see overlap between social, psychological, and biological factors because you're not this like isolated human. You're in an environment. So your environment does impact your psychological and your biological.
But conversely, if you do go on vacation and you are still depressed, then you're depressed.
Then yeah, you need to think about that. It's an overgeneralization because you may be on vacation with the person who's causing you to be depressed, right? I always say you could eat as much kale as you want, but if you're with a toxic partner, you're kind of screwed, right? So like think about what's the science of your happiness. Look at your relationships because your relationships are the number one predictor of your outcome, right? Being in a toxic relationship will drain you. So if you go on vacation with this person who is toxic, you're not going to be rested, so that it's not as simple.
So your relationships are what, the number one predictor of your long-term like health outcomes, or?
Yeah. So like there was a recent, I can't remember which study it was, but they looked at the quality of people's relationships, and I believe it was at Harvard.
Oh, the Harvard study on human flourishing, adult.
Yeah, that's
like that.
Yeah.
80 year,
you know of it, yes. So your relationships, if they're healthy and supportive, and you look forward to them, you have better health outcomes. And when you look at Alzheimer's dementia, and you look at risk factors for having worsened dementia, your relationships are really important, super important. And I believe there was a recent loneliness study where it showed that being alone and not having good connections is almost as dangerous or more dangerous than smoking a pack of cigarettes or something like that. So pay attention to the people in your life. It's not like a matter of, okay, I'm going to stay with this person just because it's easy and, like I don't have to deal with going out and dating. Think about whether or not you want to part with them long term, because that could be the source of your, health outcome, your longevity science. Don't discount it. Don't say, oh, like I'll just wait until I find someone better. Really think hard about who you want to be with, who you're spending time with, who your friendships are, who your coworkers are, who your boss is. Those relationships matter.
Yeah, great advice. So true. Well, high functioning, who would you write this book for? I'm so excited for this to get out into the world. I think it's so important. And it's, definitely something that I think many more people than you might think are struggling with. So who is best? Yeah. Who's your target audience?
If you're pathologically productive and you are busying yourself, this book is for you. This book is for the single mom who is just taking care of everyone else but herself, for the entrepreneur who doesn't ever want to fail again, for the immigrant kid who can't let the people back home down, who just pushes through pain, for that doctor, that healthcare worker who's taking care of everyone but themselves. This book is for the rock, the person who everyone depends on, but really no one else is looking out for them. This book is for that person. And for people who have anhedonia, who are just going through the motions in life and they want more joy, they want to feel as if there's more purpose, this book is for them.
Amen. Love that. Well, thanks for coming out. I've got one last question for you before we get to that. Where can listeners connect with you on social media, and where can they pick up the book?
Well, thank you for having me. This was so much fun.
So fun.
You can follow me at Dr. Judith Joseph on all the socials, and drjudithjoseph.com, and check out my high functioning book.
Dope. And the book is available everywhere, Amazon,
yes,
local
everywhere.
bookstores. Yeah, we love that. So cool. And is this your first book?
It is.
Congrats.
It's like my book baby. I love it.
Oh my God. No, congrats. Congrats. And when did it come out, or does it come out? Like, what's the release date?
April 8th, 2025.
Amazing. So fun. Well, thanks again for writing it and for advancing this topic. I think it's super important stuff. And mental health, I mean, it's a big thing. It's super important. We talk a lot about physical health. We talk a lot about emotional health. We talk a lot about environmental health, super important. But mental health, I mean, depression is so difficult. So, and I know a lot of people today are struggling with it clinically and this sort of hidden variant that you so eloquently describe. So, again, just really important. The last question that gets asked everybody on the show is, what does living a genius life mean to you?
Oh, living a genius life is understanding the science of your happiness. I'm going to say it over and over again.
Hey, I mean,
you got to understand you. I mean, people come to me and they're like, I want you to fix me. I'm like, but do you know who you are? Do you really know who you are? Have you validated the pain you've gone through? You are one in a gazillion, trillion, whatever the number is. There will never be another you, ever. So you're here for a reason. So get to know who you are. Understand your science. Understand the science of your happiness. There's nothing better than that.
Hear, hear. Thank you, Doc. Hey, if you liked that video, you need to check out this one here, and I'll see you there.